I said it in the right order, kind of close. Okay, that's where your mnemonics help. You can use the mnemonics from your lab book or in the lecture book also they are given. Okay, so the first and foremost thing is you need to know how many nerves, how many pairs, what are their names, how do you give them, assign them the number, the Roman numerals 1 through 12. That's the easy part of it. And then you need to figure out the function, category, whether it's sensory, motor, or mixed. And then in this book, they have given you the origin, insertion. I'm not going to worry about that for the test, but you need to look up the damage. What, if you damage any of these nerves, what will happen? And then how do they test if there is a damage? But these are all related. If you know the function, you know what happens. If you damage, you lose that function, right? And how do you test? Test for that function. So it's not magic, but still sometimes even the straightforward things in the exam, somehow you miss out on that, so you need to be careful, right? So even the origin insertion like muscle action, if you know the action, you can relate the origin insertion. Origin was hard. The same thing here also. If you know what it is doing, that's where your nerve should end. Right? But for your testing, you need to know those columns. Composition.
I don't know what that is. I have no idea what that is.
Tribal on us.
It's not me.
That's true.
I don't know what it's doing.
Well, that was a little break for everybody.
Oh, I know.
Some music.
I have my cousin's phone.
Let me turn mine off before it starts going. Hope we can all do that. Okay. What book you have? 8, 6, 7, 4. We are on chapter 14 towards the end. You will see the cranial nerves. I have 5, 4, 7. Okay, so you can see in the posterior view of the, or rather I should say the inferior view of the brain, you can see all the various cranial nerve endings numbered 1 through 12 and all the names. I know you know these names by now if you are in the lab, but I want to give you a minute to make sure you go through the names and you can figure out the numbers. Okay, and there are mnemonics in your lab book and also in this book how to remember the names of the cranial nerves. I may have given my lab students this one. Or you may have got it from some other source. Something is missing. The anatomy fine. You guys know this already, unless you're in my lab or somebody gave you.
There's 2 T's.
Huh?
4 is a T and 5 is a T. Yeah, number 4 is in the
No,
track.
this is right. This is correct.
Not according to this book. See here, has
No,
trochlear.
wait.
Terminates.
I know. I switch my mnemonic. Oh, once one takes the.
There.
See, even if you know the mnemonics, if you switch, everything switches. So it's good to understand and learn. This is just help.
It's easier.
See, if I had said, like I said before, without using this, I would have got it right. I used this, I messed up here, it messes up everything else. Is that correct now? Vagus or vestibulo cochlear?
Vestibulo Cochlear.
So the category of these nerves, which ones are sensory? Obviously, without having to memorize. Smell, so sensory. Vision, right? Hearing. Which ones are motor? Obviously, there's one in the name itself. And what others? So all these are motor. 3 of them help to move your
We got lashes. We got lashes.
I know. The rest mixed. Right? 3 sensory, 5 motor, and the rest mixed. Okay. The trigeminal, if you look up in the table, it has 3 branches. Okay. So one goes here, one goes here, one goes here. Can you look that up? Trigeminal. That's why they call it trigeminal. So depending on where it goes, you get name for that branch. What are the names? Where is it going? Ophthalmic. What do we have here? Maxilla, maxillary. What do we have here? Mandibular. These are helpful in detecting sensations from the upper and lower part of the face. As you can see, the mandibular, if you see the function, is motor. It moves your mandible so you can chew the food, mastication. That's what they have given for the motor function if you look up. So that's why, so these branches are sensory, this is motor.
What do you do if it's, never mind. I gotta figure that out.
I think they have the last column. Are you talking about the damage?
No. It was a different question.
Okay. What about the facial muscle primarily is involved in facial expressions, but there's one branch that's helpful with some other functions. You'll see that. So if you can look up the facial muscle, nerve, how many branches you have? 5. You have to do like this, okay? In some books they have the image, like how they branch, okay? One is called, what do they have, the bottommost?
Cervical.
Cervical, mandibular, buccal, zygomatic, and temporal. So if you touch in the right places, then you can remember those branches, where they go. And then you can relate that to the function. So it has 5 branches: temporal, zygomatic, buccal, mandibular, and cervical. That's again a mixed nerve. Some branches have sensory function, some have the motor function. What about the glossopharyngeal? Where do you find it? These 2 muscles, I may have told you, are you can think of the glossy appearance of the tongue. These 2 relate to the tongue. One is associated with movement because it's a motor nerve, right? Movement of tongue. This one is associated with various functions, but primarily taste, besides related functions on the tongue. Vagus, you can think of vagus as a very important nerve. So it goes to, if you see the picture, it goes to pretty much all the organs in your body, starting from your oral cavity, the muscles, around the pharynx, around the cervical region, down to the heart, lung, kidney, stomach, intestine, liver. So, multiple organs. Accessory spinal is primarily involved. It goes, if you see the figure, it goes down like this from the lower inferior end of the brain, and it's involved in head, neck, and shoulder movements. So you can kind of use the spinal, this word, to relate to this region. The spine is, of course, back here. But you can see the branches going to your sternocleidomastoid and also the trapezius. Can you see that? Okay. So this is one way you can learn the cranial nerves, but we need to quickly go through the tables together. Okay. This is an overview or a summary, whichever you want to call it, of the 12 cranial nerves in terms of name, number, category, and primary function. And you have to always remember the last one we ended in the last class, we talked about the cerebral lateralization, right? Meaning the right side, the nerve detect everything from the left side or operate everything on the left side, or the cranial nerves on the left work with the right side of your body. So if you have a damage on one side, it will affect the other side, the organ that is going to be affected. Right? So that's something you have to remember, because in the exam, if you see a question, you may pick both the right. Right is damaged, right nerve, some nerve, you will pick the right side of that body. No, it's the other way around. So like if both are affected, like in this case, optic nerve, if one is affected, you lose the vision for that visual field on that eye. If the right one is affected, if it's the left, if both are affected, we'll go blind, right? Okay, let's do the tables together. If you will go to table 14.1. We are going to go through the composition, function, effect of damage, and clinical test. Okay. The rest you can work on your free time. Origin, termination, cranial passage. Even those will be obvious if you know your bones and basic terminology and anatomical terminology and some of the structures we saw in the brain and all the different foramen on the skull. Okay. Olfactory, number one. Sensory, smell, it's the function. So you know the olfactory nerve has the olfactory bulbs on the inferior side of the brain. So that's where they're terminating, right? Cranial passage, it goes through the cribriform plate on the ethmoid bone. You remember the cribriform plate, the sella turcica and all of that. Effect of damage, obviously you lose the sense of smell. So the test would be to give something for the patient to see if someone can smell or not. Number two, optic nerve, again sensory, function vision. So where does it originate? It's not hard if you know your eye. Retina is where the light is focused, so that's the origin. Insertion or termination, they end up in the midbrain, thalamus midbrain. Passage, there is an optic foramen, if you remember your skull, right? Effect of damage, blindness in one or both eyes. So people do inspect the retina and test for peripheral vision, okay? So sometimes when you go to an optometrist or ophthalmologist, they make you look both sides and they bring the light closer to see if your eye can move both sides and also to see if your iris, the nerve that operates the iris opens, closes when the light is brought closer and so on. So they do for a reason. Now we know that, right? Unless your physician told you why is he doing that, or even if you asked. Or if you wanted to get out of there, then you wouldn't have asked. Oculomotor. Oculomotor, trochlear, obtusans. Three nerves work with eye movement. So I want you to look at the muscles that oculomotor operates. Okay. So if you see the function, it helps with opening of eyelid, eye movements, opening of eyelid, pupillary constriction, and focusing. So where are the fibers of this nerve going? What are the muscles? If you did the eye in the lab, what are these muscles called? Superior rectus, inferior rectus, medial rectus, lateral rectus. Medial rectus you can tell based on the superior oblique. It's always on the medial side, unless you see the lacrimal gland, which may be missing in some models. Okay, so this is your superior oblique, and then here you have your inferior oblique. So oculomotor operates all these eye muscles, including the levator palpebrae for the eyelid. There's a muscle for the eyelid, raise the eyelid, right? It operates everything except which two muscles? Look. It operates all the eye muscles except which two? That's why I put it on the board, so at least you have some help. Put all the names up there. If you know where to look, you can find the missing ones. At least I want one person to help me here.
One's the lateral rectus.
Okay.
The medial rectus?
Don't guess. You have it right in front
On
of
the
you.
superior loop.
Exactly. You have to do it, guys. I mean, if you don't do it now, how are you going to remember for the exam? If you cannot tell from your book where to look, what to do. I did tell you to explain the columns, so you should have looked under the column where it says termination, where they terminate. They have the long list of muscle names. So all these muscles are operated by the oculomotor. And then while we are discussing this, let's look at the other two, the abducens and the trochlear. Okay, the abducens operates which one? You have the book, you have the table, you have the name of the nerve. Please go look up and tell me, please.
The lateral rectus.
For which one? Which muscle? Abducens, exactly. The way you can remember, abducens moves your eye away from the midline. So that's lateral movement. So it has to operate the lateral rectus, if that helps. So what we are left with, the other nerve for the eye movement. What's the third nerve for the eye movements? Trochlear. So that operates your superior oblique. Okay. So unless you work on yourself when you get a chance, something like this, like I'm doing, it's hard to, unless you can memorize everything line by line, it's not going to help. I hope you do something that helps you to remember things for your test and think logically wherever possible so you can do better than your third exam. Okay. Okay, so if you see the oculomotor, it works with all those muscles with those two exceptions. So depending on which muscle is defective, you'll have drooping eyelid, dilated pupil, or inability to move eye in some directions depending on which muscle, and difficulty in focusing. So this is again tested by having the patient look at different directions, move the eye in different directions, how the pupil responds to the light, whether your eyelid can go up or not, and whether you can track moving objects. They pass a light, right? And they ask you to look at the light. Yes, no?
Yes.
Have you been to your annual exam? If you do one. So you can see the trochlear, that branch is going to the superior oblique. This results in inferolateral movement, so you may not be able to do this if you damage this. And if you look at the abducens, it operates your lateral rectus. If you damage, you cannot move your eye laterally. So they test for lateral movement of the eye to see if it's functioning normal. And then if you see the trigeminal nerve, you have three branches, three divisions: ophthalmic, maxillary, mandibular. Ophthalmic senses touch, temperature, pain, pressure from the upper face. Maxillary from the lower face. Mandibular, same as the V1 and V2, meaning the previous two divisions, but it has an additional motor function, which is mastication. So if you lose the function of any of these divisions, accordingly you lose sensations from upper face, lower face, or in case of mandibular, you lose sensation and problem with chewing. And let's look at the facial nerve. You have 5 branches. What about the functions? It's mixed. sensory function is taste for this. Motor function, mainly facial expression and secretion of all the fluids you can think of in your face, meaning tears from eyes, saliva, the mouth, nasal and oral mucus. So all those secretions, facial expressions and the secretion of these fluids. Okay. Damage, inability to control facial muscles. So the muscles will sag. So you won't have the proper expression. Taste will be impaired. Mainly, what kind of taste is going to be affected if you damage this nerve?
Sugar, your taste for
Sweet taste, okay? So facial nerve, if somebody has a sweet face, you can think of the sweet taste, okay? So, you will lose that sense. Vestibulo Cochlear helps with hearing and equilibrium. So you will, depending on which side is affected, you will lose hearing in one ear or both the ears. And based on the right or left nerve, you lose the function on the left or the right ear, and also difficulty to balance. Glossopharyngeal is mixed. It helps with taste, touch, pressure, pain, temperature, sensations, like when you drink coffee or something cold. And motor function, salivation, swallowing, gagging. And this one helps you with other tastes, bitter, sour taste. So the facial nerve, one of the branches, helps with your sweet taste. The glossopharyngeal helps with your bitter and sour taste. How do you test? You ask the person to swallow something and see if he can taste sour or bitter things. Vagus, again mixed nerve. It goes to multiple organs, so you can see a bunch of functions there. Taste, sensations of hunger, fullness, gastrointestinal discomfort. And for motor function, you have swallowing, speech, deceleration of heart, bronchoconstriction, gastrointestinal secretion, and motility. So if you know the organs to which these are going, you can relate the function. And primarily they look for hoarseness in your voice, if you have lost your voice, any problem with swallowing or gastrointestinal movement, if you damage this nerve. Accessory nerve, you can see that going down through the jugular foramen to your muscles on your neck and shoulder, like the sternocleidomastoid and trapezius. So you will have difficulty in moving those muscles and those movements. Last one, hypoglossal, goes below the tongue and then it operates the tongue. So if you impair this nerve, you will not be able to move the tongue. You will not be able to move the tongue either to the left or right. Or if you damage both, you cannot put the tongue out, protrude the tongue. So basically by moving the tongue, it helps with many things like speech, swallowing, manipulating the food. Right. So it needs some work, but you can do this. Okay, I want to give you 5 minutes, then I'll start on the autonomic nervous system. If you want to look up anything on this.
What is motility mean? Motility?
Motility, movement.
Or just movement in general?
Movement. Food, gastrointestinal motility, whether you are able to move your food from one part to the other part, from the stomach to the intestine, intestine to the small to the large, and so